I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care today. I'd like to introduce my two guests who are with me today, who've joined to share their child's experience with vomiting. No doubt vomiting is one of the more unpleasant events for all involved. I think my guests would agree with that. This is Carey, the mother of Cooper, an extremely busy 11-month-old, and Galadriel, the mother of Darian, who is 2 months old and can probably match Cooper in energy, I would guess. Welcome. Let's start with you, Carey. Why don't you talk about the episode that your child had with vomiting? What exactly happened during that time?
Well, it started off with a nap. Cooper and my older daughter and myself were napping, and we woke up, and all of a sudden it was all over us. It was still coming, and it was all over my kitchen floor, my dining room floor, and I started to get worried at that point.
How many days did the vomiting go on?
Just 2.
2 days. And was there anything else with the vomiting? Any cough, runny nose, fever,
No.
diarrhea? Just
No.
had vomiting.
Just vomiting.
And then it went away after that. And what happened with your child?
He first refused to eat, and then he was sent home from daycare due to vomiting twice at daycare. Then we got him home and proceeded to continue to vomit everything that I was attempting to give him.
So what did you keep doing when he was vomiting?
Just try to comfort him and I was trying to give him Gatorade, water, just anything to keep him hydrated. And it was a long road. But it lasted about 2.5 days.
And how about you? What was your biggest concern?
The dehydration.
The dehydration. I think most parents are concerned about dehydration, and the gut reaction when they throw up is to try to give them something to drink. But they're just not ready for it. So, unless you're really in the mood to clean up again, it's probably best to stop for a little while. And you'll read different things from different people. My rule of thumb in the office, because I know the parents well and can watch the children well, is to wait 4 hours before introducing anything, and then start with little sips, because if you give a full glass of anything at that point, it's probably going to come up right away again, and we really haven't given the stomach a chance to just rest long enough to take things down. Dehydration is always a concern, and dehydration is something that, if anything is going to land them in the hospital needing an IV to get fluids, it would be dehydration, but it doesn't happen instantly. So you really have to decide how little the child is and how fast they're going to get dehydrated. For a newborn or a child under 1 month of age, they need to be seen right away for vomiting. And if it's green in a child who's a couple weeks old, that's extremely concerning because you worry about an obstruction. But as a child gets older, it becomes a little bit easier to know whether a child is dehydrated. There are multiple ways of deciding whether a child is dehydrated. Some are more accurate than others. I think looking to see whether the mouth is dry and sticky or whether it's moist, if a child is crying, whether we're having tears coming out of our eyes, I think that's really helpful. A child who has tears coming out is not at the point of significant dehydration usually, and can usually be watched a little while. The mouth, if it's really dry and gummy, that's showing you that we're starting to get there. Number of wet diapers is a really great way of telling. A child under 1 should at least have a wet diaper every 8 hours. By the time they're over 1, maybe 2 a day would be sufficient, but you want 2 to 3 wet diapers a day per child. If they're urinating, it's coming from somewhere. Sometimes I have parents check capillary refill. I have to say I do that because it's an easy gauge, although it's not always the most. There are reasons why it may not be accurate, so it's important to know what's going on with your child. They can have multiple reasons, including high fever, that what we call capillary refill isn't really a solid way of checking. But basically, we're pinching the nail bed for about 5 seconds, and you just count 1/1000 up to 5, and then let go and see how fast that nail bed pinks up. And if it pinks up under 2 seconds, then we have an indication that maybe we're not dry. And sometimes over the phone, it's an easy way for me to tell that, and the mouth being moist, I sort of put pieces together. I sure wouldn't rely on any one item solely, because I think some can be a little bit misleading, but it's certainly a great way of dealing with that. Tummy pain, I think that's a really big one with the vomiting. How about yours?
He would cry suddenly before actually throwing up, and then he would whimper a little bit afterwards, but then it would settle, and then that was about it.
And that's really classic for just simple vomiting, where they will have a lot of discomfort. They will, and if they're old enough, they will, usually over 2, they'll say, my tummy hurts, and then suddenly they don't give you much warning. They tell you, my tummy hurts, and you better get that bucket fast, because they'll throw up all over the place. And then afterwards, they feel really fine. So that or they might whimper a little or cry. So you have some indication that their tummy is bothering them. And if it's for a short time, that's really not too concerning. But if it goes on for more than 2 hours of tummy pain, then you start to worry about, do we have appendicitis? Do we have something else that's causing them to vomit? They can throw up from the appendix, from an obstruction or something going on in the tummy. They can throw up from a urinary tract infection, from a pneumonia. So there are many things that can potentially go on because of that. Typically, I like to wait about 4 hours before introducing anything, and then I like to start with small sips of something. If it's just simple vomiting that's happened for a very short time, and we haven't really gotten to the point of significant dehydration yet, because really, you'd have to go, for most children, quite a few hours of throwing up, especially if they're not having diarrhea and losing that extra fluid. You have to really go possibly a number of days before you finally get to severe dehydration. And sometimes you can just work on giving them normally what they typically give if they're a little older, although you don't want to do this long term. For short term, I'll take a 7-Up and stir it so the bubbles are out, but just give an ounce and then wait 20 minutes and see what happens. Oftentimes, we introduce fluids too soon and we give too much, and it comes flying out because the tummy isn't ready for that. So I like to give an ounce, wait 20 minutes, see what happens. We keep it down, give another ounce, wait 20 minutes, and then increase the fluids, and then get back to the normal kinds of fluids that we take as we know that the stomach can handle it. Vomiting typically goes from 12 hours to 3 days, usually 12 to 24 hours. I think after the second day of vomiting, it's important to call for some help and ask the physician whether there's something going on with it, but that would be it. And then again, it's important to know whether something else is going on. I think fever is really key with that. Why are we throwing up? How do they act? Are they like themselves, or do they seem disoriented? You want to know. You have to think about what your child has taken in terms of medications. Is this causing a problem? Did they get into a cabinet and get into something that they shouldn't have? Did they choke on a coin or a foreign body or something that they shouldn't have? So there are other things that one really needs to be aware of, especially with the little ones who are all over the place. If blood comes out when they're vomiting, that would certainly be a reason to be concerned and come to the pediatrician. It could be as simple as a nosebleed that was causing some blood, but you really never know without being looked at. So they really need to be assessed. As far as reintroducing solids, there's really nothing wrong with going back to a regular diet as soon as they can tolerate it. So as soon as you know that they're able to hold down food, I think we're doing fine with them. So the general approach with vomiting is to hold off until you know the vomiting has stopped for a number of hours. Start with small sips of something to drink. As they're able to tolerate it, move on to introducing solids, and hopefully within a day or two, it will resolve on its own. If it goes on for more than 2 days, it's really important to see a physician. If something else is going on with it, in addition to vomiting, it's important to see a physician. And that is our talk on vomiting, and I thank my guests for sharing their experiences with us. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to drcareys.com, where at Dr. Carey's, we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.